quarter till 2. This is the Senate Committee on Health. Couple of real quick items. Item number 6 is going to be a consent item. That's SB 1100, Mining Workers Occupational Safety and Health Training and Educational Programs. We have 15 items today, so we have a pretty packed schedule to go. Before we get started, I just have a real quick point of personal privilege. I've got some very good friends out there in the audience that are here to visit. We have members from the California Optometric Association today here. It's their lobby day. And of course, you know, I'm an optometrist and I've known many of these for many, many years and decades. So I'd like to welcome everybody from the California Optometric Association. Okay, looks like we've got our first item is item number 3. We got Senator Hill, SB 994, antimicrobial stewardship policies. As soon as we can establish a quorum, we'll interrupt. But other than that, Senator Hill, welcome and good afternoon.
Thank you, Mr. Chair and members. SB 994 would establish antibiotic stewardship policies in outpatient health settings, something that is already required by law in hospitals and nursing homes. The bill addresses the problem of antibiotic-resistant infections, which kills at least 23,000 Americans each year and which the CDC has identified as the top public health threat. Outpatient health settings are an important focus because the majority of antibiotics are prescribed in those settings and up to 50% of them are not needed, driving the development of this deadly public health problem. To address concerns from opposition and committee members, I circulated amendments yesterday and had intended to present them today. But after discussing them with everyone, it seems they don't fully address all of the concerns, so I will not be asking you to vote on them today. Instead, I want to express my commitment to work with the California Medical Association to amend the bill to require continuing medical education for physicians on this subject. The Medical Association approached my office late yesterday afternoon and expressed their willingness to work with me on continuing education amendments instead of a stewardship policy. The hope is that continuing education would help promote better, more appropriate prescribing, helping to reduce the impacts of antibiotic resistance. And it's my goal to reduce the antibiotic and overprescribing of those antibiotics in the office and outpatient setting. How we do that really isn't a priority for me. How we get there isn't the concern. If it were to be a stewardship program, requirement is one thing, but if we can do it through continuing education, that would be a good thing as well. I'm not married to any one specific protocol, just as long as we, at the end, get the results that are necessary. So in closing, I'm asking you to vote on the bill in print with my commitment to amend it in appropriations to remove the requirement for antibiotic stewardship and instead require mandatory continuing education in antibiotic stewardship for physicians as part of their ongoing continuing education. So I respectfully ask for an aye vote, members. Thank you.
Thank you. Do you have anyone that would like to speak in support of the measure? Any support? Any opposition? We have support? No.
I'm Kelly Brooks with the County Health Executives Association of California. We represent the local public health departments across the state. Public health officials in California continue to be alarmed by the rise of antibiotic resistance. According to the CDC, at least 2 million Americans are infected with antibiotic-resistant infections, resulting in at least 23,000 deaths each year. And we're pleased to be supporting this bill today.
Thank you. Anyone else? Please state your name and position.
Thank you, Mr. Chair and members. Megan Allred on behalf of the California Dental Association. Just wanted to officially remove our opposition per the author's commitment to take these amendments. We really appreciate his flexibility in working with us and understanding of our concerns, as well as the committee's analysis, which I think did a good job of kind of outlining where we are on our data, and look forward to working with him as more data is available, but just wanted to let the committee know that we'll be removing opposition per the committed amendments.
Thank you. Anyone else in support? Opposition to the bill?
I know we are tag teaming.
Alicia Sanchez with the California Medical Association. We are opposed to the bill in print. We are very appreciative of the analysis and pointing out that, guidelines for outpatient settings do not yet exist. And so it's very difficult to understand what exactly the requirements would be for the bill as it's drafted. We appreciate the author being willing to work with us on continuing education, and we'll see if we can get someplace where we can all feel comfortable. Thank you.
Mr. Chair and members, Tim Shannon, representing the California Orthopedic Association. When this bill was heard in the Business and Professions Committee, we pointed out that the main issue that's been raised about over-administration of antibiotics occurs in a primary care setting. Orthopedic surgeons follow CDC guidelines when administering antibiotics both before and after surgery. So we had some issues with the stewardship program and asked to be amended out. I just wanted to go on the record and note that we just learned today about the continuing education approach, and that's troublesome as well. We have traditionally opposed mandatory continuing education, and particularly in the instance of orthopedic surgeons where the administration of antibiotics follows very strict protocols. It would probably not be necessary. Thank you.
Thank you. Anyone? Yes, opposition.
Yes, Lydia Bourne, representing American Academy of Pediatrics. We also are opposed to the bill in print. We just received some new amendments, and so my committee has not had a chance to look at them until we come to a different conclusion. We still are opposed.
Thank you. Questions, comments for any of the members? Yes, Senator Pan.
First of all, Senator Hill, I want to thank you for your leadership in looking at antibiotic stewardship, and I know that you're working very hard with various stakeholders. A physician who ran a clinic which actually had a very low antibiotic prescription rate. I know some of the challenges it takes to make that happen, and I look forward to hopefully working with you as this moves forward to try to get to the right place. I have to admit, I also have some reluctance to support mandatory CME, but I think there's some effective things we can try to do to achieve the aims that not only you, but I know what you're doing on behalf of the public to try to be sure we reduce antibiotic resistance. And so I would be happy to vote for the bill and even move the bill here today so you can continue that work. And I look forward to our continuing dialogue for that.
We will.
Senator Hill.
And if I could, Mr. Chair, and I appreciate Dr. Pan's comments and the idea, because the goal is not to burden or overburden. And continuing education, you could be required to have hours and hours. My sense is this would just be a little part of that, and a very small part, but just to keep an ongoing awareness of the problem and the issue and how it can best be served. So that'd be it. So thank you. Appreciate it, and I vote, members. Thank you on this, and we will.
We don't have a quorum. I see
When the time comes.
Bonning coming. Literally, Nielsen left. If we can get him back, we can set a quorum and we can actually address your issue. Sergeants, can you find out where Nielsen is? Any other questions or comments from any of the members? So I've got not any questions. I got a couple comments. As you know, I went through BNP. I didn't vote for it there because I knew it was going to come to the Health Committee. I understand and applaud you for wanting to bring the issue with regard to overprescription of antibiotics, but I told you what my overall concern was, and I was going to be a non-recommendation. I wasn't going to be opposed to it, but I wasn't going to vote on it. I'm glad that you're going to be working with the opposition. I will say my only question, it could be potentially a concern I would want to share with Senator Pan as well, is well, I guess I have a question. So are you talking about expanding the number of hours or just including it within their CME?
Well, I don't know, and here again, this just came about last night, but we wanted to work with them. My sense is it could be included somehow in the CME. I'm not thinking of making it a more, and it doesn't seem like it has to be. The goal is to create an awareness, create an ongoing consciousness of the issue of overprescribing. And to me, the continuing education could be just including that and how to consciously make yourself aware of every, when you write a prescription, what is the medical need for it, and is it appropriate, is it necessary? Just more common sense.
We're going to go ahead and get a quorum. Secretary, call the members, please.
Hernandez here. Nguyen. Hall. Mitchell. Monning. Monning here. Nielsen. Pan. Pan here. Roth. Here. Roth here. Wolk. Wolk here.
The quorum has been established. Sorry, Senator. anyway, go ahead.
And once we finalize the language, once we get it working with the appropriations in your committee, we will certainly share it with the B&P committee as well as Health to make sure that everyone is comfortable with it.
And again, let me just reiterate, I think my only questions is, are you going to increase the number of hours, which I think the CMA is going to be extremely opposed to? Are you going to require a certain number of hours within their CME? Then there may be some questions as well. How are you going to deal with the dentist? How are you going to deal with the orthopedic surgeon? So I'd be more than happy to obviously continue working with you. Obviously, I have the right to bring the bill back if, there's a concern, and I'll work with Senator Lara and appropriations to make sure that all parties are okay. I still won't vote at this point. I think you should have enough votes to get it out, but at this point, is there you have a question, Senator Money?
Thank you, Mr. Chair. Senator, I'm sorry I missed your presentation, and if I go over ground you covered, I apologize. I do understand it's a work in progress. I applaud the objective of trying to get some controls on overprescribing or unnecessary prescribing of antibiotics. My question goes to, I think you had author amends that are now kind of off the table as you're working on this, but I'm particularly curious about inclusion of dentists and podiatrists who I'm not sure they're appropriately included or why, in terms of their level of prescribing antibiotics.
And if I could, Mr. Chair and Senator Money, they were included mainly because the concern of CMA at the time was they felt, well, if you're going to include us, you should include all of the health professionals. Chiropractic board wanted to be included. They said that they were comfortable. I mean, I'm sorry, it's another issue. That everyone felt that we should have everyone kind of part of this, the requirement. And so what we're trying to do now is kind of remove those that really don't have the concern, but more importantly with the conversation today is that we're looking at from basically the CMA came to our office yesterday and talked about having this as part of continuing education. It was their suggestion. I think it's a great suggestion. As I mentioned, I'm not married to the idea of having a stewardship program in each office. The goal is just to create the awareness and the conscious prescribing of antibiotics when it's done. And so that's what we're trying to do. And as part of that, we will kind of pare it down a little bit to make sure that it only applies to those where it's necessary.
Great, and I will be supportive today, but I will be watching as it makes its way through the process, and I understand a potential interest of CMA to be inclusive or not feel like they're singled out, but by the same token, if there's not evidence to show that dentists or podiatrists are regularly prescribing antibiotics, which I'm not aware that they are, I'm not interested.
Only about 10%, so it's a small amount.
So, but anyway, you're attuned to that.
Yes,
I'll follow it
absolutely.
with interest, and thank you.
And that was great that the analysis pointed that out as well, so we will definitely take that into consideration.
All right, thank you. We have a motion? Moved by Senator Monning. We have item number 3. It's due pass 2 appropriations. We are not amending in this committee. We've got a commitment from the author that he will amend in appropriations, which I'll coordinate and work with the Senate Appropriations Chair. If we need to bring it back, we'll bring it back. I'll call the members, please.
Hernandez. Nguyen. Hall. Hall, aye. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Aye. Roth, aye. Wolk. Aye. Wolk, aye.
Currently has 5. That's enough to get out. We're going to place that bill on call. Thank you. We see Senator Cannella. Item number 5, SB 1098, Medi-Cal Dental Services Advisory Group. And we do have support on both sides. Senator, welcome. Good afternoon.
Got it. SB 1098 creates an advisory group to oversee Denti-Cal policies and priorities. For more than 13 million Californians of modest means, Denti-Cal is the only means to dental care outside of an emergency room. As a member of the JLAC Committee and the Little Hoover Commission, I've heard many accounts that Denti-Cal rules and processes are often harmful to beneficiaries. Most California dentists don't participate in Denti-Cal due to its low reimbursement rates and administrative obstructions. Fewer than half the people eligible for benefits use them in any given year. I represent counties with high populations of child beneficiaries where there aren't enough dentists. The impact of this program on my constituents leads to expensive emergency room visits, missed school days, and lost job opportunities. So as a member of the Little Hoover Commission, I recently participated in a hearing on the Denti-Cal program. One of the recommendations that came from the hearing was the creation of an evidence-based advisory group to oversee the program's policies and priorities. This bill creates a 15-member advisory group consisting of the state dental director with members appointed by the governor, the Senate Rules Committee, and the Speaker of the Assembly. The members would serve a 3-year term with no term limits. I also request that you approve my amendments that add 2 additional members and remove the section of the bill that requires that the dental director be the chair of the advisory group. I'm pleased to welcome Carol Delea, I knew I was going to mess it up, the executive director of the Little Hoover Commission, as a witness on this bill. So.
Thank you. Please state your name and proceed.
Sure. Good afternoon, Chair and committee members. My name is Carol Delea. I am the executive director of the Little Hoover Commission. Last year, Senator Pana and Assemblymember Wood asked us to look into and review the Denti-Cal program. This was after the scathing state auditor's report. We unanimously adopted a report a couple of weeks ago. We found a system that was broken in many ways, including a department that was seemingly at odds with the providers that are needed to serve the 13 million Californians that are served by the program. Based on our report, we're very much in support of SB 1098. It sets a goal to improve access, and it also, as we recommended, creates an advisory group. Many people during our process told us that the decisions that the department makes seem to be unilaterally and mysteriously made, and they often don't seem to include outside views. It was part of an overall alienation between the department, the providers, and beneficiaries. During our review, we heard repeatedly that the provider community had very little input into Denti-Cal decision-making. The outcome is widely perceived as not good. During our process, there were 2 issues that were being considered by Department of Healthcare Services. One dealt with general anesthesia, the other dealt with hygienists regarding services to remote clients. And the way that the process worked highlighted how the department seemed to ignore outside input. We heard from, at our hearing process, as well as through phone calls, through emails, parents in particular of children and special needs population who were stymied with teeth that were in pain and waiting for the state to decide on its murky rules. We decided rather than to weigh in on the issues that what was needed was this outside advisory group. We felt that the Denti-Cal decision-making process could benefit from expert outside guidance, more of a high-level group than a stakeholder panel. We envisioned a body of independent experts to use the best evidence and science to guide policy and make the most effective use of available money. They would assure that rules and policies are based not only on cost, but also on the best ways to improve oral and overall health for the population being served. I urge your vote on aye on SB 1098, and thank you.
Thank you. Anyone else like to speak in support?
Good afternoon, Mr. Chair and members. Megan Allred on behalf of the California Dental Association. CDA has worked for years to address the deficiencies in the Denti-Cal program, and I was very encouraged last year with the Little Hoover Commission's review and the findings that came of that, just because there is now a lot of movement in the program and the ability to make some vast improvements in it. We know that Denti-Cal needs changes both to increase the low provider rates and correct administrative barriers that currently burden the program, and we applaud the author's focus on the goal of increasing utilization for child beneficiaries to at least 60%, making the program more comparable with the commercial market. Addressing the deficiencies of the complicated program will take a multifaceted approach and will require the input of dental care experts, best evidence, and all possible resources. For this reason, we are pleased to support the intent of SB 1098 and look forward to working with Senator Cannella and all interested parties to identify the right makeup and structure of such an advisory committee. And we would appreciate your support moving forward so that we can continue to make progress on this broken program. Thank you.
Anyone else support?
Terry McHale with Aaron Reed and Associates representing the California Dental Hygienists Association. Our hygienists participated in the Little Hoover Commission hearings, and everything that the chair has said is absolutely true. It is also want to note that Senator Cannella had his staff walk over with us and actually participate in a meeting with the department. And I think what we all learned was the department was very isolated and insulated as they made their decisions. It was almost like an Haldeman-Ehrlichman situation in which they weren't allowing outside influences to be heard. And I think this is a smart bill that will bring greater clarity and information to what they finally decide to do. I do want to make one quick distinction, however, and that is that the problems we had with the department, we did not have with the agency. That when we took our complaints to Secretary Kent, that Jennifer Kent was extremely responsive and very open to discussion, and we appreciated that very much.
Thank you. Anyone else? Any opposition to the measure? Questions, concerns? We have a motion by Senator Roth. Would you like to close?
Just respectfully ask for an aye vote.
Thank you. At item number 5, SB 1098, do pass as amended. 2 appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
Thank you.
Currently at 7. That's enough to get out. We'll place that bill and call. Sergeants, can we call some more members, please? Senator Pan, would you like to go up? Because it looks like no one's out here.